Environmental emergencies can happen anywhere, from the home to the workplace to the outdoors, and they often arrive suddenly in the emergency department. They range from heat illness and cold exposure to drowning, bites, poisoning, and toxic inhalation. Nurses need to be able to recognize them quickly, intervene effectively, and anticipate complications. Let's walk through the major categories. We'll begin with heat. Heat-related illness develops when the body can't regulate its temperature effectively. At the mild end, you see heat cramps, often in people working or exercising in hot environments, caused by sodium loss and dehydration. Heat exhaustion comes next, with symptoms like heavy sweating, weakness, nausea, and dizziness. But the most dangerous is heat stroke. This is a true emergency. The hallmark is central nervous system dysfunction, such as confusion, delirium, or seizures, combined with a core body temperature above 40 degrees Celsius, which is 104 degrees Fahrenheit. Sweating may be absent. The priority is rapid cooling, and timing matters. Cooling that begins within the first hour of onset is strongly linked to survival. We use methods like immersion in ice water, cooling blankets, cold intravenous fluids, and evaporative techniques, all while supporting the airway, breathing, and circulation. Older adults are at particular risk because their ability to adapt to heat is diminished, especially if they live alone or lack air conditioning. Prevention is also key. Adequate hydration, avoiding strenuous activity in peak heat, and awareness of vulnerable populations. Cold exposure produces the opposite set of emergencies. Frostbite is localized injury from tissue freezing, most often in fingers, toes, nose, and ears. The affected skin becomes pale, hard, and numb. Rewarming must be rapid but controlled. A water bath around 37 to 40 degrees Celsius for about 30 minutes is standard, and pain management is important because the thawing process is extremely painful. Blisters may form, and severe cases can progress to necrosis. Careful handling is critical. Rubbing or massaging frozen tissue causes further damage. After rewarming, sterile dressings, elevation, and infection prevention with tetanus prophylaxis are essential. Patients should also avoid tobacco, alcohol, and caffeine, since all impair circulation. Hypothermia is more systemic. It happens when the body's core temperature drops below 35 degrees Celsius, which is 95 degrees Fahrenheit. Mild hypothermia brings shivering and lethargy, but as the temperature falls further, shivering may stop. A very bad sign. Heart rhythm instability is a major danger, with risk of ventricular fibrillation. Management depends on severity. Mild cases can be treated with warm blankets, warm fluids, and a heated environment. Moderate to severe hypothermia requires active internal rewarming with warmed intravenous fluids, humidified oxygen, or even extracorporeal warming. Always remember the rule. Treat hypothermia first, frostbite second, because systemic rewarming improves circulation to the frozen extremities. Now let's turn to non-fatal drowning. Survival for at least 24 hours after submersion is the definition, but even if the patient is breathing on arrival, complications are common. Hypoxia is the immediate threat. Patients may need oxygen, intubation, and positive end expiratory pressure. Hypothermia often coexists and must be addressed. Pulmonary edema and acute respiratory distress syndrome can develop hours later, so monitoring doesn't stop after stabilization. Prevention remains the most effective tool. Pool fencing, life jackets, supervision of children, and education about rip currents save lives long before someone ends up in the emergency department. Another condition tied to pressure changes is decompression sickness, sometimes called the bends. It occurs when nitrogen bubbles form in the blood after a diver ascends too quickly or after exposure to rapid altitude change. Symptoms range from joint pain and dizziness to neurologic deficits and cardiopulmonary collapse. Management begins with high-flow oxygen and intravenous fluids, but the definitive treatment is recompression in a hyperbaric chamber, which helps nitrogen redissolve and safely leave the body. During transport, the patient should be kept warm and at the lowest possible altitude if air transfer is required. We also see emergencies from envenomation. Snake bites, while uncommon in many regions, can be life-threatening depending on the species. Local tissue damage, swelling, and systemic effects, such as coagulopathy or neurotoxicity, may appear. First aid emphasizes immobilization of the affected limb, keeping it at heart level and avoiding harmful interventions like incision, suction, ice, or tight tourniquets. In the emergency department, priorities are airway, breathing, circulation, wound care, tetanus prophylaxis, and careful monitoring. Antivenin, when indicated, is administered with caution because of the risk of allergic reaction or delayed serum sickness. Tick bites are another source of systemic illness. They are common in wooded and grassy areas and can transmit diseases like Lyme disease and Rocky Mountain spotted fever. Lyme disease has 3 stages. The first often features a characteristic bullseye rash and flu-like symptoms. The second stage may bring joint pain, neurologic problems, and cardiac symptoms. The third, if untreated, can cause chronic arthritis and neuropathy. Removal of the tick with fine tweezers, grasping close to the skin, and pulling straight out is the correct method. Patients should be educated on monitoring for fever, rash, or joint pain after a bite, and prophylactic antibiotics may be considered in certain cases. Poisoning is another major environmental emergency. When corrosive agents are ingested, such as drain cleaner or battery acid, they can cause devastating tissue damage. The nurse's first concern is airway, breathing, and circulation. Never induce vomiting if caustics or petroleum distillates are involved. Activated charcoal can be useful for many substances, but it does not work on caustics, iron, lithium, or hydrocarbons. Gastric lavage is rarely indicated and only within 1 hour of ingestion in life-threatening cases. Throughout treatment, vital signs, cardiac monitoring, fluid balance, and seizure risk must be closely observed. Poison control centers are an essential resource, and all suspected ingestions should be discussed with them. Discharge planning includes education about poison prevention and, if the ingestion was intentional, psychiatric evaluation before leaving the hospital. Finally, let's look at carbon monoxide poisoning, the most common fatal poisoning. Carbon monoxide binds to hemoglobin 200 times more readily than oxygen, forming carboxyhemoglobin and rendering the molecule useless for oxygen transport. The result is tissue hypoxia, particularly in the brain and heart. Patients often appear intoxicated, confused, dizzy, weak, sometimes with headache or palpitations. Skin color is unreliable, and pulse oximetry is misleading because it reads hemoglobin saturation without distinguishing what the hemoglobin is bound to. The definitive test is carboxyhemoglobin level. Treatment begins with moving the patient to fresh air, loosening tight clothing, and supporting airway and circulation. The main therapy is 100% oxygen, preferably in a hyperbaric chamber, until carboxyhemoglobin levels fall below 5%. Long-term complications can include psychosis, movement disorders, vision problems, and permanent brain damage. If the poisoning was accidental, public health authorities should evaluate the source like a faulty furnace. If intentional, psychiatric consultation is essential. Environmental emergencies are diverse, but the principles of nursing care stay consistent. Recognize the problem early, secure the airway and support breathing and circulation, remove the patient from exposure, initiate specific therapies, and anticipate complications. Prevention and education are just as important as acute management. From heat stroke to frostbite, drowning to poisoning, the nurse plays a central role in saving lives and reducing long-term harm.